Ostomy services. What is an ostomy? An ostomy is a surgically created opening in the body that allows discharges of waste through the abdominal wall. What is a stoma? Actual end of ureter or small or large bowel that can be seen protruding through the abdominal wall. Common causes for ostomies: inflammatory bowel disease, which could be ulcerative colitis or Crohn's disease, colorectal or urogenital cancer, congenital disorders such as Hirschsprung's disease or spina bifida, and trauma. For many patients, having a diversion surgery is a life-saving operation. Reactions to the surgery consist of body image concerns, self-esteem concerns, self-care concerns, and relationship concerns. There are 3 types of ostomies, first being a colostomy, a surgically created opening of the colon. Second being an ileostomy, surgically created opening of the small intestine. Third being a urostomy, surgical procedures which divert urine away from a diseased or defective bladder. Remember, a peg or feeding tube is not an ostomy. It is important that patients understand the basics of caring for their ostomy, such as skin care. They must maintain healthy skin around the stoma. Bathing and showering. Shower and bathe as before. Soap and water will not flow into the stoma. Shower or bathe with the pouch on or off. It is really up to the patient's personal preference. Diet and fluids. Some foods should be avoided, but for the most part, a healthy diet including fiber is sufficient. Odor. Pouching system has an odor barrier filter. All ostomy patients, new or old, will be seen by ostomy nurses. Nursing staff order ostomy supplies when patients are admitted. Talk to the patient. They may know the size of appliance they need. If the patient does not know the size, order 2 3/4 2-piece system. This size will work for most patients. HUCs have a copy of the formulary at their desk. This here is a picture of the ostomy formulary that HUCs will have at their desk. Remember that HUCs and nursing staff are able to order supplies from central stores. Sizes are color-coded accordingly. Make sure when ordering, order the same size for bags and flanges. Make sure when you look at your boxes that your colors match your flange box and your ostomy pouch box. Here is a picture of the flange. With this flange, you will apply next to the patient's skin. If a 2 3/4 flange is ordered, you may have to cut the flange in order for it to fit the stoma. The pouch picture here is a drainable pouch. This pouch is used for formed waste. If using a drainable pouch, close the lock and roll microseal closure at the bottom of the pouch. The pouch picture here is a urostomy pouch. This pouch is used for liquid waste. Remember, when using these pouches, to keep the adapters. Only 1 adapter is available in each box. Do not throw them away. If using a urostomy pouch, make sure the drain valve is closed. The teardrop on the drain valve should face the body side of the pouch. If desired, apply the cap provided in the box. Before getting ready to apply the flange, skin prep pads should be used. Window pane the skin where the fabric of the flange will be applied. This helps the barrier stay in place longer. Adapt rings may be used to improve the fit of your pouching system. They can be stretched or molded to fill in crevices or creases. You may choose to apply the barrier ring to the adhesive side of your skin barrier, or apply the barrier ring to your skin and then apply your pouching system. Ostomy powder is used to absorb moisture from broken skin around the stoma. This allows the skin barrier to adhere so the skin can heal. Apply a small amount of Aide stoma powder to the irritated open skin area. Reapply if needed to coat the irritated area. Gently brush away excess powder using your hand or a soft tissue. The powder should stick only to the raw area and not be left on dry, intact skin. It is important when cleaning your skin around your ostomy site to only use non-moisturizing soaps and water. Patients should not use wipes or moisturizing lotion to peristomal skin. When preparing for ostomy care, gather supplies as needed. Gently remove old appliance. Clean around stoma with bar soap and water. Make sure that it is dried completely. Measure stoma with guide that is provided. You will find a guide located in the flange barrier box. Apply flange barrier around stoma. Make sure that skin prep is applied around edges of the flange. Connect pouch to the flange barrier. Routine care of ostomies to remember is empty pouch or bag when it is 1/3 full, or when contents in the bag reaches the Hollister name that is actually on the bag. Replace barrier flange every 5 to 7 days. Do not use oils or lotions on skin around barrier flange as it can interfere with adhesion. Apply pressure and warmth of hand to hold flange in place and to help activate the new adhesives. Cover appliance when bathing, showering the patient. It is important to report these changes to the patient's primary care nurse. Reddened skin, black hill, bluish or purple skin mark, rashes, denuded or raw skin, skin tears, other unusual skin conditions. Remember to document your prevention interventions. The picture on our right is a skin reporting tool that can be used to help determine skin abnormalities on a patient. When an abnormality is noted, make an X on the picture where the abnormality is seen. Complete the information needed, such as patient's name, room number, and primary nurse's name. At that time, you may give the yellow copy to the primary nurse and keep the white copy for your records. Three ostomy nurses are available at UMC Monday through Friday, 7:30 to 5 p.m. They can be reached in their office or by pager.